Good evening. Thank you all for joining us tonight. My name is Amanda Monholland, and I am the Acting Public Information Officer for the Shawnee County Health Department. I am also on the Shawnee County COVID-19 Public Information Response Team. In the spirit of the Safer at Home order, our public information team has created a frequently asked question document, which is posted on the Shawnee County Health Department Facebook page, the Shawnee County Health Department website, the city website, and the COVID-19 updates Facebook page. We encourage everyone to utilize this resource to alleviate confusion and the volume of inquiries with capacity to address them all. The Safer at Home order is to keep everyone safe, so please stay home. This order takes effect tonight at midnight. Please note that you can still take care of family members, you can still walk your dog, and you can still go to the grocery store, among others. With that, I would like to introduce our speakers for tonight. Health Department Director Linda Oakes, University of Kansas Health System St. Francis CEO Steve Anderson, Executive Director Child Care Aware of Eastern Kansas Riva Waiwatas, Emergency Management Planner Aaron Mahan, and the Mayor Michelle De La Isla. With that also, I would like you all to please hold your questions till the end of the media conference. Linda, are you ready to go?
Thank you, Amanda. Good evening. Tonight we have 20 pending cases, 229 negative, and 135 monitoring. I'm also here to announce tonight our first positive cases for Shawnee County. We have 3 positive cases today. 2 positive cases were received at Stormont Vale Health and 1 at the University of Kansas Health System, St. Francis, Kansas. 1 is a female age 70. We have a male age 23 and a male age 73. 2 of the patients have traveled out of state. And now I'd like to have Steve Anderson come up and talk about his hospital response.
Good evening. A patient with COVID-19 has been admitted to the University of Kansas Health System St. Francis campus. The patient is a male in his 70s with no travel history. Appropriate PPE was used from the moment of arrival at the hospital. We want to reassure the community that our staff is well prepared and trained. We have a multidisciplinary physician-led team working 24/7 to maximize our capacity and prepare for a potential surge of patients. Thank you.
Thank you. There's a few other points I wanted to go over tonight. The first is we've gotten a lot of questions about the Safer at Home order and whether you need passes or badges or paperwork to travel to your job if you're an essential worker. And the answer to that is not at this time. You do not need any kind of paperwork to travel to your essential job, to the grocery store, to other essential services that you're accessing at this time. But again, we want people to stay home as much as possible. Try to limit your trips. That will help with our trying to keep our numbers down. With the Women, Infant, and Children program, or WIC program that we administer here at the health department, we are doing all that remotely now. So if you are on WIC and you need to talk to us about your benefits, if you need to get on WIC, the number is 251-5607. That's 251-5607. Also, the other day that we would continue doing immunizations, TB skin testing, and STD and TB management. We are going to continue those services. It is by appointment. So again, please call our office, and the number is 251-5700. 251-5700. My last comments before Riva comes up and talks is about child care for people who are working in essential services. There's been a lot of questions about whether child care can stay open, and the answer is you are providing child care to people who have jobs in the essential services, which are all listed in the order. We would like you to stay open and help those parents who are working in those essential jobs. There are some guidelines to those child care. So it must be carried out in stable groups of 10 or fewer. And stable means the 10 children in the group. Children should not change from group to group. If more than one group of children is cared for in the facility, each group should be in a separate room. Groups should not mix, and the child care providers should remain with the same group or class. So I know there's still probably a lot of questions. We'll be happy to answer those as we can. The number for our child care licensing department is 251-5750. That's 251-5750. And I asked Reva Waiwatis to come tonight. She is the Executive Director of Child Care Aware of Eastern Kansas, and she's going to talk to you about some services for child care providers and parents looking for child care. Reva?
Hello. As Linda said, the child care landscape is changing significantly as a result of this order, and our primary focus, of course, is keeping everyone healthy and safe. So we will be providing technical assistance to our child care partners. And we also want families that do fall in that essential workers category to be able to the child that they may need at this critical time. We keep real live data on our website. Any family can go to the web, ks.childcareaware.org, and do their own child care search. That information is updated very frequently by the child care programs. And we're also asking programs if they close or if they have vacancies that maybe they didn't have yesterday to be sure to keep that information current so that those essential workers can find the child care that they need. Anyone that's struggling to find child care, if you don't have luck doing that online search, you can also call our office at 357-5171 right here in Topeka, and one of our resource specialists will be glad to assist you and offer whatever services are needed to help you find child care for your children. So reach out if we can assist in any way. We want our children to be in safe, healthy environments, and we want those families in the critical services to have the child care that they need. Thank you.
Good afternoon. Just here to touch on a little bit more of what Director Oaks was talking about when it comes to critical infrastructure or essential services, as was stated in Dr. Pizzino's order. If you have any question whatsoever as a small business owner or the employee of a business within Topeka or Shawnee County, and you have questions, or you're just not sure whether the business can open or remain open, or what services are provided by your organization, you are more than welcome to call one of us in emergency management, or we have also set up a phone bank that is staffed by critical infrastructure volunteers. That phone number is 785-251-4848. There's also an email address that has been assigned to this if you have questions that you need to ask of emergency management. That email address is www.covid-19@snco.us. Remember, with your essential services, that also includes the critical infrastructure such as natural gas, water, and electricity, along with communication, internet services, and the like. Also remember that if you're a vendor that provides a service in order to keep a critical infrastructure online, you will be considered as well. But if you have any questions whatsoever, please reach out. Thank you.
Good afternoon, community. So what we were hoping and praying for did not pan out. We have 3 cases in our community, and at this point in time, aside from the information provided to you all, we don't have any additional information with regards to how it was contracted. Once we have more information on that, we will get back in touch with all of you so that we can all share that with the community. This is almost like confirmation that everything that we have been doing up to now was the right thing to do. I know that we were very cognizant that more than likely the virus was in our community and that we were just waiting for a test to reflect it. I think that we are the first county in Kansas that had 3 to pop up at first, and check to see if that's correct, but I think that we are the first one to have more than one show up in our community, and I am eternally grateful for our hospitals, to do the work that they are doing to ensure that everybody stays safe, and for working so hard to expand their capacity so that they can provide services in our community. Now, Dr. Pezzino yesterday made the comment of the meme that we have all seen of the two doctors saying that they are working so that you stay home. We want you to remember that every single time that we have one case in our community, our medical personnel has to work a lot harder, and they are put at risk. Not just our medical personnel, but also the first responders that are trying to provide the help to those individuals. Us enacting the Safer at Home ordinance ensures that we are all at home, that we are all safe, unless we are critical personnel. And I ask all of you to please, more than ever, please respect the order. Please respect the order. We have 3 cases. We don't need more. A little bit of information that I wanted to share was that we had a great conversation today with some faith leaders in our community. We received a lot of questions, and we know that you have questions. I'm going to ask of all of you one thing. I want you all to understand that there is a significant team that comprises the city, the county, the health department. We have amazing PIOs, which are information officers in different organizations, that all come together to make decisions, as well as emergency management, who has really been a key factor in our success here. I want you to understand that as we are putting out information, we are doing it understanding that you are still going to have questions. These are absolutely emotional times. And my call to all of you in the community is to please treat the individuals that are putting information out with grace and respect. We are more than happy to answer any questions that you may have. We are more than happy to talk to you through your anxiety. But in a time like this, we need all of us to come together. We need all of us to have a little bit of grace, because we all understand that we're all working under pressure to serve you. We're not going to be perfect in delivery. We understand that. But we are willing to keep working with you. Let's now, more than ever, expand an extra ounce of kindness out to each other as we navigate these difficult times. Shawnee County, Topeka, we will overcome this, make no mistake. We have excellent doctors. We have excellent hospitals. Between Stormont and San Francisco KU, we have amazing medical personnel. Yesterday, we celebrated the fact that we were one of the top 5 in the state to have in medical care in the state of Kansas. Remember that. But please, be kind. Stay home, and be kind to each other. I'll transition now into Spanish. El día de hoy hemos anunciado que tenemos 3 casos positivos en la ciudad de Topeka y en el condado de Shawnee. 2 de esos casos se encuentran en el hospital Stormont Vale, y uno de esos casos se encuentra en el hospital KU San Francisco. Nosotros no tenemos muchos detalles. El doctor Anderson compartió un poco de información. Una de las personas de esos casos tiene solamente 23 años. 23 años, recuerden eso. La otra persona está en los 60 y la otra persona tiene 70 años. No tenemos información de cómo esos individuos quedaron enfermos con el virus, pero a la vez que tengamos la información, la vamos a compartir en la comunidad. Linda habló sobre el Plan WIC donde usted recibe ayuda para sus niños, y ahora ya no va a estar de cara a cara, ahora va a ser por la vía del internet. Por favor, llame al 785-251-5607, 785-251-5607, si necesita ayuda con el WIC. Hablamos también sobre el cuidado de niños. Las personas que están cuidando niños necesitamos que se mantengan abiertos si pueden, pero solamente para personal esencial. Así que, por favor, si tiene preguntas, comuníquese con la organización local que recibe toda esa información de cuidado de niños, que se llama Child Care Aware. La página web es ks.childcareaware.org. Es ks.childcareaware.org. En esa página web va a encontrar no solamente información sobre cuáles son las personas que proveen cuidado que están disponibles, pero también las personas que proveen cuidado pueden llamar y registrarse en esa página para que padres que estén buscando a alguien que los ayude con sus hijos puedan ir ahí. Finalmente, hablamos con las iglesias. No hemos llegado a todas, pero estamos pidiendo que reguen la palabra. tenía muchas preguntas de cómo vamos a hacer lo de los servicios. Y el doctor Pezzino nos dio instrucción hoy que solamente pueden estar 3 personas en la iglesia para hacer el servicio. Una persona grabando, la persona que está dando el mensaje y una persona para que haga música. Así que 3 personas en las iglesias para los servicios religiosos. Es importante que recuerden que nosotros estamos ahora mismo buscando un formulario para que nos digan si usted es un negocio esencial. Si tiene preguntas, llame al departamento de emergencias al 785-251-4848 si usted es un negocio y quiere saber si usted cualifica. Y también tienen una página, un email ahora que es covid-19@sncco.us. Finalmente, están preguntándonos si les vamos a dar un carnet, dejando saber que usted puede estar conduciendo el auto. Y no vamos a dar un carnet. Nosotros simplemente estamos hablando con los empleados y haciendo una lista de quiénes son esenciales, pero en este momento no estamos dando, Shawnee County no va a dar un carnet, Emergency Management no va a dar un carnet, nadie va a dar una carta. En este momento no estamos dando documentos certificando. Así que, por favor, manténganse en casa. Cuando salgan solamente para hacer compra, para ir al médico o para lo esencial. Y vamos a mantenerlo seguro. Este es un momento en el cual si tiene ansiedades o tiene miedos, le pido que sean bondadosos con cada uno. Nosotros sabemos que usted tiene ansiedad y que nosotros hemos tomado determinaciones para asegurarnos de que ustedes estén seguros. Y cuando tenga preguntas, hágalo bondadosamente. Ese es el momento en el que nosotros estamos dispuestos a escucharlos, pero vamos a trabajar juntos como comunidad. Porque recuerden, nosotros vamos a salir de esta. Pero para eso tenemos que trabajar todos juntos. Recuerden los doctores que están en Stormont y KU, que están trabajando para usted. Por favor, quédese en casa.
Somebody graciously reminded me that I got the email wrong for a second time when I gave it out. So I have the correct email address for any COVID-related matters that you may need. That email address is covid19info@sncco.us. COVID-19info@sncco.us.
Muchas gracias. Erin del Departamento de Emergencias, del Manejo de Emergencias, nos acaba de decir que el email que le di para cualquier pregunta de manejo de emergencias estaba incorrecto. El email correcto es covid19info@sncco.us. Otra vez es covid19info@sncco.us.
Before I open it up to questions tonight, I would like to go ahead and announce that tonight on the COVID-19 Updates Facebook page at 6 p.m., we will have a live Q&A with Dr. Pezzino, so please be sure to come back to our page at that time. With that, we're going to open up for questions. I do want to let you know that we have Brian Hill, Sheriff Brian Hill, and Chief Bill Conkran here in the audience as well for questions for availability, okay?
Would someone be able to clarify if the 3 cases, are they all Shawnee County residents or are they being treated in Shawnee County?
Yes, they are all 3 Shawnee County residents.
And so this is different than that Woodson,
Yes.
okay, so.
Can you tell us if they all came from one place?
They did not all come from one place. 2 of them traveled from out of state, the other did not.
And the 2 that traveled didn't travel together?
No.
And then I have some questions for you. If you could explain how supplies are at the hospital, how many defibrillators do you have, and ventilators, I'm sorry.
Sure. Yeah, we've got capability to put 25 different patients on ventilators. That's our supply, 25. We've also got over 50 negative pressure rooms for patients. So we're feeling good about that. We'll see what the potential surge may look like.
And then for the person that you're treating, are they staying at the hospital or are they at home now?
This is an inpatient, yes.
Okay. And I know this was a while ago and things changed rapidly, but before it was if we found a case, we would try to trail where they were, who they were in contact. Are we still able to do that? Is that what you guys are working to do?
That is still happening, correct.
Okay. And so, how are you doing on testing? Are you testing at the hospital?
We have been sending to the state lab. We're working with our partner, the University of Kansas Health System in Kansas City, where they've developed in-house testing. So we'll be using that testing facility very shortly with very quick turnaround time. So we're looking forward to that service.
And do we know how fast the turnaround time would be?
It'll be within half a day. Within half a day.
And do you know how many tests you would be able to do in a day?
As many, I believe, here as we need to do. I know what the maximum number is there, and it's a big number. It's a big hospital downtown as well in Kansas City, but we'll have, our needs here will be met. I'm certain of that.
And are you currently trying to get more supplies, more ventilators, more masks and stuff?
Sure, we're working with our national vendors, and we feel like we're in good shape at this point. We have many shipments on the way, thousands of N95 masks, gowns, and so we've been working on this diligently the past several weeks, and we feel like we're in a good position at this point.
I have questions for police department. You know, I have a question for you too.
Oh, me?
Yeah, I think both of you. So, will officers be writing tickets for anybody who doesn't have a approved reason for leaving the house? So, for example, if you guys were just pulling someone over and asked where they were heading and that reason was a non-essential reason, would they get a citation ticket?
Well, I think the health department, Linda Oaks, and city manager, or emergency management with Aaron, both stated that how that process is going to work. And so we still have constitutional rights. We're not martial law. You can be out and about, and there are reasons to be out and about. Now, it's not out of the question that if you get stopped for a violation or something else, the officers can't ask, you know, are you out within the confines of this or not? But it's very important to keep in mind that there are several exceptions to the order, and so people are going to be out, but we are not going to be randomly stopping people because we still have this thing called the U.S. Constitution, and it's still in effect.
Now, how have things been going since the announcement is made that at midnight this change will happen? Are people behaving themselves, going to grocery shopping and stuff? Have you had to patrol any more areas?
Actually, I've been pleased with the response the public has done so far. I've talked with Chief Cochran. We've been planning for this since this calamity has hit our nation. We're ready to support and do the duties that we're required to do, but we want to work with the public, okay? This is more of a safety, education. We both have families. We understand this. This impacts us on not just the law enforcement level. I had a daughter today that left to go to a hospital where she's still having to do duties as a student even. So we understand what's going on with this, with the community. We want to just let everybody know we're out here to support the people of Shawnee County, and I've been honestly pretty pleased with the responses that we've got from the community here.
I think the important thing to keep in mind is it hasn't started yet. It starts tonight. And so that's very important. But as the sheriff said, we've been in constant communication. We work in the DA's office. We've been working with the county jail. And I think the important message here is that if you knowingly violate it intentionally to do harm to the public, because the whole thing is the safety of the public, keep people safe, that enforcement action will take place. So we're hoping for voluntary compliance. We're very comfortable with that. We've been very comfortable with what has happened so far. And as you see, if you're out and about, there's not as many people out. And so I think this is, and I think even more importantly now with 3 positive tests in Shawnee County, I think the message ought to be really plain and clear. You're safer at home, and when you're at home, your community is safer and everybody else that lives in it is safer. So please, voluntary compliance. Give this a couple weeks, just like we're asking. Talked about the last week, all through the last week, we'll pay benefits to everybody that lives in Shawnee County.
You know, I would like to make the community aware also that at the Sheriff's Department, we've rolled out a good neighbor program. There's a number, if you get on the website, people who are isolated, without family, elderly, not wanting to go out into the community. If you'll call that number, we're ready to assist, up to picking up groceries, things that might be of need to citizens of Shawnee County. So, again, we all are in this together. So.
Okay, so just one more time, I want to remind everyone, 6 o'clock, we're going to be live again on COVID-19 Updates Facebook page with Dr. Pizzino for a live Q&A. I guess, thank you for coming, and if you have any requests for interviews, we'll attempt to get that person here for you at a next upcoming media conference. Okay, thank you, and have a good night.